This episode is proudly brought to you by the TPG Telecom Foundation, dedicated to creating opportunities to improve the health, well-being and education of Australian communities in need. Hi, I'm Megan Gilmore, MissingSchool co-founder and CEO, and this is Live and Learn. This is the podcast that unearths insights at the intersection of health and education, building a powerful alliance to keep kids with complex health conditions connected to school from anywhere. The podcast is recorded on Ngunnawal land, and we acknowledge and pay respect to the traditional owners of this land and the land on which you're listening. Welcome to our weekly webcast, a place to zero in on the interplay between health and education and to amplify the voices of those supporting school students to navigate their educational journeys despite complex health challenges. And today we have with us Dr. Joel Ten. Dr. Joel Ten is a general practitioner with over 15 years of clinical experience in hospital and clinical settings. He has worked across multiple specialties, including emergency medicine, psychiatry, obstetrics, paediatrics, internal medicine, and general practice. A member of the National Asthma Council Australia's GP advisory group, he is an active health educator and regular spokesperson. Welcome, Joel. We're so excited to have you on Live and Learn today.
Thank you so much for the very kind introduction.
It's our absolute pleasure. And so today we're here to talk about supporting school connections for students with complex medical or mental health conditions. Let's head to the first question. Joel, tell us how asthma impacts kids and why it's something every Australian needs to know and care about.
Yeah, no, that's a really good question. Unfortunately, asthma actually affects quite a number of children, actually. The statistics suggest that it's about 1 in 9 Australian children. So it's really one of the, most common chronic conditions for Australian kids. When I think about asthma, my son has it himself as well. It can really affect a child's ability to play, to learn, to sleep, and in the really severe cases can even lead to hospitalization or even death. And as a parent, with a child with asthma, I can certainly say that, yeah, this is pretty much all of those things. When he's gotten a virus and he's having an attack, he's not able to sleep well at night. He was actually hospitalized once for the condition as well. So that's why it's something that affects a lot of families, and it peaks during school terms. So it's something that really every Australian should be aware of, not only to manage the problem effectively, but also to support the children who are living with it as well.
Yeah, thank you for that enlightening introduction. 1 in 9, that's a lot of kids.
Yeah, absolutely.
And so many people probably assume things about asthma. What's the million-dollar question that you get from parents or loved ones when their child experiences or is diagnosed with asthma? I guess you can draw on your lived experience here.
Yeah. Look, I mean, probably the most common question is, will my child grow out of it? And I personally myself had asthma as a child, and I also grew out of it as well. And there are some kids who do see improvements as they get older, and that's a really great thing. Asthma is a variable condition, however, so our focus really needs to be on good management of the condition rather than just thinking, he or she is gonna grow out of it, one day. So, the short answer to that question, will my child grow out of it, is really, it depends. Yeah. Wheezing in children under 5 can often be transient. Sometimes, it just comes only when they've got a bug and then it goes away and they never have any issues out of it. But, for others, asthma can persist into adolescence or adulthood itself. So that's why, for me, whenever I get this question, will my child grow out of it? I always tell parents, look, let's treat them, make sure they're well treated, and maybe they will grow out of it in the future, but it's one of those things where we will have to see. Mm.
Yeah, thank you. And you probably have answered my next question, which is what's the most important thing that you want them to know?
Yeah.
But you may wish to add something to that if there's anything else sitting
Yeah,
there.
yeah. Look, I really want to, tell parents and people who do have asthma out there that the big thing is that asthma is manageable. Okay. Like, can't promise a cure or anything like that. But honestly, with the right plan, the right medications, and the right supports, most kids with asthma can live very full, active lives. But really, early diagnosis and consistent follow-up are really the key points. My son, he's just doing things as any other kid would. He's on his preventer, he takes it regularly, and he just does everything as a normal child would. He doesn't even take anything whilst he's at school, basically. So you can live a really full active life as long as we manage it properly.
Yeah, that's a great message for people to hear out there, and reassuring too, given the number
Mm.
of children who have asthma.
Yeah, absolutely.
So um, you partially answered this one too, but
Mm.
I won't make any assumptions.
Mm.
We'd love to know if you're willing to share what brought
Mm.
you into the world of asthma.
Yeah, well, I guess I almost in a sense stumbled on it by accident, in the sense that I've been working as a GP for many years now, since 2011, and I happened to be working many years ago in a practice with an asthma nurse, and she happened to be a part of the National Asthma Council.
Mhm.
She said, "Hey, do you want to get involved? Do you want to help us out?" And I thought, "Oh, yeah, why not?" And as someone who has had asthma myself, thankfully no longer as I grew out of it. But I thought, it's something that I'd like to be involved with, and so kind of almost fell into it, and I just got more and more involved, and
Mhm.
especially as I mentioned earlier. My son then developed it as well. I thought, oh, well, I'm kind of, in the right space
Yeah.
in a sense to be able to, help him out, but also just really educate people. And, as I've been working in community health, in the past, I really saw how sort of asthma unfortunately disproportionately affects families, in lower socioeconomic backgrounds. I'm fortunate. I've got a medical background, and I know how to treat asthma, but even then, when you're in the thick of it, it's difficult. Like, I still brought my son to hospital because, I still wanted, you're a parent first and foremost, and then you're a doctor second.
Yes.
No matter who you are, but still, regardless, it does disproportionately affect those in those low SES backgrounds, unfortunately. And many have ended up in emergency departments for something that, with good education management could have been prevented.
Mm.
And so that's why I really want to, be able to help educate people because, as they say, prevention is better than cure. And why wait until you're at a really bad point and you need to be in hospital when we can manage you, effectively in the community setting?
Yes.
Mm.
I have two observations there, or one observation and a question. It's so interesting when I ask that question of people, and more often than not, people say, "I just stumbled into it," and
Mm.
this has apparently become a passion in their life almost.
Mm.
So that element of serendipity, of finding
Mm.
yourself in something that you can't help but stay
Mm.
involved in.
Mm.
Um, and the second one is a question, just wanted to know when you say affects or disproportionately affects people
Mm.
in lower socioeconomic circumstances.
Mm.
So the prevalence is the same,
Mm.
but is it, well, I should ask, is the prevalence the same? And by effects, you mean the management is not as good in those circumstances, leading to complications?
Yeah, yeah. So, yeah, exactly right there. So overall, as I mentioned, the stats are about 1 in 9. But the real issue is that, I guess, unfortunately, when those who are perhaps less well educated, they don't realize what kind of condition this is.
Hmm.
Some people are less likely to pay attention. Maybe they just think, oh, my child's got a bit of a cough. It's not going away. Happens every time it's winter, but they just kind of put up with it, or they don't realize that there are effective treatments. They think, oh, it's kind of their lot in life in a sense. And so that's why it's really all about education. It's not normal for your child to be coughing all the time. It's not normal that they can't really go out there and play in the playground without feeling short of breath.
Mm.
It's really educating people to tell them that yes, it is actually possible to treat this condition and to treat it well so that they can, live better lives. But it's not only just about the short term, because some people think, oh, like it's not that bad, but really long-term consequences can be quite
Mm.
unfortunate, because they can chronic asthma not properly well managed not only can have dire situations when they get a really bad flare up, which leads to hospitalization, but in the long term can also affect their lungs in a more permanent way,
Yeah.
reducing lung capacity and leading to other conditions like COPD and so on. So that's why the key is to manage it well and properly, and to educate people to say that yes, there is something that we can do for this condition.
Yes, thank you for clarifying that,
Mm,
because it was a question that I had lingering based
mm,
on you talking about how important management is. And obviously,
mm,
to manage, you have to first identify that this is
mm.
actually what's going on. So
Absolutely.
um, that's a great message for anyone who's out there listening who may suspect someone, a child they know might
Mm,
have asthma, be able to perhaps, assist in getting a diagnosis or
yeah,
clarity about that.
absolutely.
And and so knowing all that you know,
Mm.
what's your biggest hope for kids with asthma, their families and loved ones, when they're navigating it?
Yeah, look, I mean, for me, the big thing is that, I really want people to, families to really feel empowered, because, it's nothing worse than just feeling helpless and that you can't do anything about it. So empowerment is really key. And, I just want families to be able to have that confidence to manage asthma, to know when to act, and so that their child doesn't miss out on life because of
Mm.
it. I remember before we had kind of a really firm, diagnosis with my son. There was this time when he'd just been recovering from a cold, and he still wasn't better, and he wasn't on a preventer yet. And it was his school athletics carnival the following day, and we brought him along, and he was trying to run the cross country, and he had to pull out at the end. He was in tears because his chest wasn't feeling great, and he was upset, and that was just really sad for me. And the following year, when he was properly well managed and everything was under control, he did the cross country, and he came in fifth place
Yeah.
after that. So from going 1 year to not being able to complete the cross country, to being able to come in fifth, that to me is just something that really goes to show that, wow, when we manage this condition well, your child can be, what they want to be, in a sense.
Yes,
Yeah.
yes, that's a wonderful example to give. Just those
Mm.
two, those two polar opposite examples.
Mm. Mm.
And what are some of the common, perhaps frustrating public misconceptions about asthma, and how have you seen that play a role or impact kids?
Yeah, yeah. So, like I think that there's a couple of things. One big misconception is that, some people think, oh, asthma is only really serious during an attack. And whilst that is true, it is serious when you have an attack, but the reality is that asthma is a condition that actually needs daily management. Even when symptoms seem relatively mild, it's kind of like high blood pressure or diabetes. You don't want to wait until your blood pressure is like 200, and you're about to have a stroke. It's about managing it every day. And it's the same with asthma. Just like high blood pressure over a long term can lead to heart conditions, asthma poorly managed over the long term can lead to other chronic lung conditions as well. And so that's why, I really want people to know that we need to manage asthma daily, regularly, even when it's relatively mild, so to speak.
Yeah.
The other thing that I hope that parents out there know is like they're really worried about preventers, especially when the word steroid comes into play. They're thinking, oh, like preventers are really strong, or maybe even unnecessary. And like the Australian Asthma Handbook really clarifies that inhaled steroids are one of the most effective long-term treatments to really reduce that inflammation that's occurring, in the airways. So, and not only does it reduce that inflammation, it prevents flare-ups. So that's why, yeah, those are probably the two big things, that, oh, we only just gotta treat it when they're in the midst of an attack, or, that, puffers, especially steroid puffers, they're really strong or unnecessary. I hope those
Mm.
things that people, can help to remove that misconception in their minds.
Yes, and it reminds me, which I should have remembered at the outset, that my father was
Mm,
chronic asthmatic as a child.
mm,
Um, and it wasn't until the advent of the preventers
mm,
that in adulthood, he's either doesn't have asthma anymore, or it's
mm,
so well
mm,
managed by the
mm.
preventer.
Yeah, yeah,
Of course,
absolutely.
he's not even on the preventers anymore, I don't think. But
Mm, mm.
it just goes to show in my own personal example
Yeah, yeah.
what you're talking about there.
Definitely.
Um, so, is there a risk of delayed diagnosis? I think there is, based on what you've said, or in most cases picked up
Yeah.
easily.
No, no, unfortunately not. I mean, yes, there are some situations where it's pretty straightforward. Kid comes in, short of breath, they're wheezing, you put your stethoscope and you can hear, a wheeze all over, and you're like, okay, that's asthma. But then there are those, kids who, not that straightforward, their only symptom is a cough. And you think, oh, is this asthma, or is it just like an annoying cough? Because a cough, there can be multiple reasons for a cough. Maybe they've got a bug.
Mm,
Maybe they've got a little bit of postnasal drip, like some mucus dripping down the back. Or maybe it is actually airways inflammation leading to a cough. And so that's why, it's really important that we actually think about, what is the reason for this particular symptom. So hopefully, parents, and those who are listening, don't just think, oh, shortness of breath or wheeze. That is what asthma is. It could be something as benign as a lingering cough, that sort of thing. So I guess it's about thinking outside the box a little bit and think,
mm,
oh, why is my child experiencing these sorts of symptoms? And,
yeah.
trick is really go and see your doctor. And
Yes.
mm,
Thank you. And what kind of complications are associated with asthma, or do kids with asthma face?
yeah, I mean, there's quite a few things. So, poorly controlled asthma can lead to a number of conditions. Like, for example, one is sleep disturbance, because unfortunately, especially as we're getting into the period where, the nights are getting cooler, for some people, some individuals, that one of their triggers for asthma is actually cold air. Okay, so as the weather cools down, and, as the night gets cooler, they can actually start coughing at night. Okay. And so that can then lead to sleep problems. And as most of us are, probably aware, if your child doesn't have good sleep, they're going to be cranky in the mornings and
Mhm.
so on. And it does affect their learning as well throughout the day. Poorly controlled asthma can also lead to school absences. It's actually one of the leading causes of school absenteeism
Mhm.
is asthma,
Mm,
actually. And as I shared earlier, with my son, not being able to run the cross country, asthma can also lead to limited physical activity because they just struggle to breathe when they're active. Some children, their trigger is actually exercise, and so the moment that they start, running and playing, that's when they start to get tight in their chest. They start coughing, spluttering,
Mm.
being short of breath, and so those sorts of things can also, like, it's a potential complication, if you will. And obviously, there could be, in the worst case scenario, a trip to the emergency department as well.
Mm.
And
Yeah.
the long-term complication, if we're talking about over years of not managing, it can lead to problems with the lungs and chronic conditions, if not managed properly.
Yes, and we don't want that. We definitely
Absolutely
don't
not.
want that.
Mm.
What about allergies? Are there allergies often associated with asthma?
Yeah, so it's that's a really good question. So things like hay fever, eczema, and asthma, they're
Mhm.
actually technically all part of the same basket of immune responses called atopy, actually.
Okay.
And so that's why asthma is quite commonly associated with hay fever, grass pollen allergies and so on as well, and eczema to a degree.
Mhm.
So yes, absolutely. They are related in that sense, particularly your grass and pollen allergies.
Yeah.
Several years ago, we had that episode of thunderstorm asthma, where people
Ah.
who had both hay fever and asthma were really severely affected, and there
Mm.
was a huge spate of people who didn't even know they had asthma, but because of those conditions where the pollen kind of swelled up with the rain and then burst into very, very small particles, it was easier to inhale into the lungs, and that resulted in what we now know as thunderstorm asthma. So in that sense, yes, allergies can definitely affect asthmatics. Not always, but it can be.
That
Mm.
could be part of the picture.
Mm.
Yes, I know that during the bushfires, that was
Mm.
another
Oh yeah,
big
yeah,
factor too. So those are
absolutely.
environmental triggers
Mm. Mm.
for children or anyone with asthma.
Mm.
So how we talk about um, siblings and peers of kids with asthma. How are they
Mm.
impacted? Do you hear any stories about this, or what should families be across with that?
Yeah, look, I mean, it's interesting because there's always a little bit of a interesting family dynamic when one particular child has a chronic health condition and the
Mm.
others are fairly healthy. Siblings, can feel a little bit anxious, especially when these sorts of things occur. If their brother or sister has a flare up, or even require a trip to the emergency, they can get a little bit worried and anxious. Sometimes they can even feel a little bit left out. Ironically, it's
Hmm.
one of those things where they kind of feel like, oh, all the parents' attention is, on that particular child whilst they're, having a flare up. And, that's when, sometimes there can be a little bit of a dynamic where, parents need to just kind of sit down and explain, what is happening to the other child so that they understand. So educating the whole family is really quite important, especially even the siblings. We, as doctors, we generally just speak to the parents because usually the sibling is not there. But when parents go home, it's also worthwhile for parents to just say, "Hey, look, your brother or your sister has asthma, and this is why they need to take these medications." And sometimes there are times when, they're sick, we might need to pay a bit more attention to them and just
Mm.
explaining it to them because children are naturally inquisitive, people, and they like to know what's going on, and it can certainly allay a lot of their concerns. Whereas when they're kept in the dark, that's when all sorts of things can play up in their little mind. So it's
Yeah.
important to just educate, all the children about what's kind of happening, and just involving them is something that's really helpful. Hmm.
Yes, thanks for that advice. That's something that also comes up on these calls. It's very interesting that the observed sibling experience is quite similar across conditions, including
Mm.
guilt and, a
Mm.
whole range of
Mm.
other things.
Yeah. Yeah.
I also imagine that, there might be more than one child in the household
Mm.
with asthma as well.
Yeah, yeah. I mean, it can be. Sometimes that is the case, because unfortunately, it can be, in a sense, passed down.
Mm,
So what we notice is that if a child has asthma, we usually ask mom or dad, do you have either of those three conditions? Hay fever, eczema, asthma. If you
hmm.
have one of those, because they're kind of all in the same basket, you're more quite likely to pass it down. And usually there is some sort of family history there.
Yeah.
It's actually pretty rare that it's like, oh, this is the first child that has any of those three things, and mom and dad didn't have any of them.
Mm,
So it certainly can be, in a sense, passed along. And so, but it's not always universal. Like, say, in my own family, I've got two kids. My daughter doesn't have asthma, but she's got eczema. But my son, he had a bit of eczema, but now it's mainly just asthma. So, those
yeah.
things can sort of pass along in a sense. Mm,
This is a little off script, but since we're
mm,
talking about families,
mm.
can asthma be expensive for families to manage?
Yeah, look, unfortunately, it can be. Those
Mm,
doctors' visits can certainly build up, and it gets even more so if you require specialist management. By far and large, most GPs can manage asthma, but there are certain ones that where it's quite a complicated situation, or they're on maximal therapy and they need pediatrician input and so on. That's where fees can start to build up as well. I
yeah.
mean, we're quite fortunate in that we do have the pharmaceutical benefit scheme, the PBS, which does subsidize a number of medications.
Mm,
But there are certain times when even those things can build up. And, whilst I was working in the community health center, I did have patients, coming to tell me, look, I haven't, gotten paid for this week. Can I pick up my medications next week? And it's always really difficult
yeah.
and sad, really, when, you come across those situations where people are limited by, the funds that they have. So even though we do have a lot of subsidies from the government, but even with those subsidies, with the cost of living crisis and so on, it
Yeah.
still can put a stretch on family budgets as well. Mm,
Yes. And then if we reflect back on um, how that might be playing into
mm,
people in low socioeconomic situations as well, even if they
mm.
do realize what it is, they may not have the means to address it.
Yeah,
Um,
absolutely. Mm,
yeah.
mm.
Um, what's the current population of school-age children with asthma, and how accurate is that data if we have it? Is it tracked, for example?
Yeah, so, with the data from the ABS, Australian Bureau of Statistics, and Australian Institute of Health and Welfare, it does suggest that the 1 in 9, or about
Yeah.
11%, yeah, of school age kids have asthma, and it's pretty good national data. I mean, we're talking
Yeah.
about all of Australia, but the I guess the reality is, not all schools and places consistently track or manage this. And
Mm,
especially when it comes to other things that are pretty good indicators that someone is well managed, like having an asthma action plan, for example. I mean, there could be a lot of families out there who are aware that their child has asthma but have quite an out of date asthma action plan. So I
yeah.
guess it's about tracking and making sure that kids do have an asthma action plan. And to be fair, I do get quite a few parents coming in, around the start of the year, to say, oh, look, can I have an updated asthma action plan? But I guess the reality is that not every school is going to
Mm,
necessarily, not to say enforce, but encourage the parents to really just make sure that it is updated regularly,
yes.
at least yearly, really. Mm.
Yes. So on the current school population of 4 million children, students, it's about 444,500
Oh yeah.
kids,
Yeah.
and they're the
That's
ones
right.
with diagnosis, right? Because
Mm,
1 in 9 is
that's right.
diagnosed. So,
Yes,
given
absolutely.
what you've said, we could
Mhm.
be looking at a higher
Oh
population
yeah,
than that.
definitely.
So, and given what you've said about disrupted sleep
Mm,
and, some recurring symptomology and things
mm,
like that, and fatigue and
mm,
um, it's it's worth considering the impact that this really does have in school and out
mhm.
of school.
Oh yeah, absolutely. Mm,
And this speaks to the next question, which you kindly answered earlier on. Do
mm,
kids with asthma currently miss a lot of school and why?
Yeah,
So,
yeah, definitely. As I mentioned, yeah, it is one of the leading causes of school absenteeism. And
mm,
it really spikes up during the colder months, when viral infections are circulating. And
mm,
the reason is basically because in quite a number of people, one of their triggers is a viral infection. So basically, when it's cold, people are indoors more, you're going to be spreading more germs.
yeah,
And so there's, that's, and so you're not only going to be missing school because you got a virus, you got a cold, but also because of the asthma. And it takes him longer, to get better because,
mm,
of those additional effects of inflammation on the lungs as well. So yeah,
yes,
maintaining good control is really important because then you can kind of mitigate the impact. I mean, we can't stop people from getting colds, but we can at least either stop them or dramatically reduce the impact of the asthma from the cold as well.
mm,
Mm.
yeah, that's great to know. And what have you observed as the critical times in the school life of a kid with asthma? Is there anything that stands out there for you?
Yeah, I mean, I think that the start of the school year is pretty important because they actually have observed this so-called back to school asthma spike because you've been at home over the summer holidays and so on, and you're not with a lot of germy kids in a sense, and then all of a sudden you put in 20, 30 kids into one room, and that's where all these exposures to
Petri dish.
viruses germ. Yep, that's exactly right. And sadly, it's also quite common for some parents to maybe get a little bit relaxed over the school holidays with medication and things like that because they think, oh, it's summer, weather's warm, they haven't required anything, and they kind of drop off on the medication. So it's kind of all of these things together,
Mm,
the return to school, all the germs, and then maybe gotten a bit relaxed over the school holidays, with medications, and then yeah, it just all spikes up, and that's when
uh-huh.
asthma rates really can come up. Yeah, so that's something that we
Yeah.
have noticed, yeah, over the
Yes,
years.
that's
Mm.
interesting. The back to school is one that comes up a lot in these conversations with other chronic conditions as well.
Yeah.
Any evidence for anxiety causing a flare?
Yeah, look, I mean, I guess thankfully, yes, the anxiety, yeah, mental health does have a bit of a role because stress can be a potential trigger for
Mm,
asthma. But usually, if it's fairly well managed, yes, there can be back to school nerves. But as long as the asthma itself is overall well managed, I think most people, it doesn't really cause that much of an issue. Mm.
yeah. And what about the, you know, puberty years, adolescence? Is there anything
Mm.
remarkable about that period?
Yeah, look, I think it's one thing that I find that a lot of adolescents go through is that they just want to fit in, and having a puffer and carrying it around, especially because when you're in
Bit
that adolescent
uncool.
age. Yeah, yeah, that's exactly right. Yeah, because they're more independent. So, like for my son, we making sure he's got the, taking his medications, every day. But when you're older, a lot of parents, and rightly so, can kind of, say, hey, look, here's your puffer, you know what to do, make sure you take it. But then especially if they have exercise-induced asthma, they really should be having a couple of puffs of Ventolin, maybe 5 to 10 minutes, before they do PE or anything
Mm,
like that. And some kids don't want to be seen as
Yeah.
requiring the use of this, inhaler, even though it gives them great, you know,
Yes.
success in being able to complete their physical activity. Sometimes because they don't want to be seen as, uncool or requiring these things, then they stop using their medication. So,
Mhm.
those are things that, I guess we really just have to, educate um, kids and to say, look, it's okay to use. To be fair, though, that's with a lot of chronic conditions,
Yeah.
diabetes and so on. I've seen similar things as
Mm.
well, where people just don't want to give themselves insulin because they don't
Yeah.
want to have to go to the toilet and hide and
Yeah.
give it to themselves. So it's
Yeah.
it's a well recognized issue, unfortunately. Mm.
Yes. Don't stand out. Even
Yeah,
more so at
yeah,
school, isn't it?
yeah. Unfortunately.
Really, yeah. So we should mark that up for anyone
Mm.
listening, including teachers, that is, of
Oh yeah.
to have that awareness around kids' non-compliance, perhaps, especially in the
Yeah,
teenage
yeah.
years.
And I think, just normalizing that, hey, there are people who have medical conditions and that's okay. Just normalizing that it's all
Mm.
right for people to take medications if they need to. Because the more, I guess, normal it is in inverted commas, then people just don't pay attention to it. Oh, they
That's
just
right.
had the puffer,
Yeah.
that's it, and let's continue on, you know.
Well, given the statistics around chronic
Mm.
conditions,
Mm.
there's there's going to be quite a substantial number of
Yeah.
of children in school environments who are
Mm,
dealing with and are
mm,
medicated for chronic conditions.
yeah.
It's an interesting point because we see education on
Mm,
chronic conditions happening in schools, and
mm,
different
mm,
groups do that education.
yes.
I wonder if there's any general education just about,
Mm,
part of being a human is involves illness. Sometimes those illnesses are lifelong, sometimes they're for a long
mm,
time, sometimes they flare up.
yeah.
And that this is just a part of life, actually.
Yeah.
I don't recall hearing that there is any of that kind of education that goes on.
Yeah.
Um,
Yeah.
we
But
have sex ed in schools and other things,
yes.
but maybe not, um,
Mm.
this is what it is to be a human.
Yeah. Yeah, yeah, that's it. I mean, I can't remember anything myself, but this is where, I just do it in my, as
Mm,
personal parenting to my own children. I say, like because, kids, as I said, are inquisitive and sometimes they'll say, oh, why is that person in a wheelchair? And then I just have to explain, that there are people who have diseases and or conditions where they
mm,
might require the use of a wheelchair or a crutch or medications. And, I just explain to them and I just talk in a very normal tone of voice that there are people who are like that and who
yeah,
have certain conditions and it's just the way it is. So that way they just feel that, oh, okay, it
yeah,
is what it is. And
it's part of life.
yeah,
Yeah.
it is absolutely a part of life. Mm,
Yeah, and I guess it's a good point for diversity, actually, isn't it? Is
mm,
that as of part of understanding diversity and
yes.
engaging oneself with the diversity of humanity,
Mm,
that this is
mm,
definitely a part of the picture, even if it's an invisible illness and we can't
yeah,
see that,
yeah,
the kinds of effects that it can have on
that's right.
people. I mean, even carrying the knowledge of it as a
Mm,
child or an adult, even
mm,
without flares or other kind of
mm.
symptomatic, can be quite substantial in
Yeah.
itself,
Mm,
psychologically.
absolutely.
And do you
Mm.
see children with asthma typically getting anxious, or it's not not big in the picture of asthma? What do you see?
In terms of anxieties and things like that, I mean, I feel like the more the child is aware, especially of their flares, they can become avoidant of them.
Hmm.
And sometimes it is a good type of avoidance, but sometimes they get to the point where they're just very anxious and always thinking about it. And
Yeah.
I think this is where we don't want it to get to that stage where they're always constantly worrying and thinking about their triggers and so on, because like I said, we want them to be able to live their lives, as normally as they possibly can, in a sense where the disease has a minimal impact on them. So I think there's this balance where, we need to say, look, we recognize these may be your triggers, and it is good to avoid them, but we just don't need to, always have it on the back of our minds. So
Yeah.
I think just again, it's all about that education and making sure that they are well controlled, because if it doesn't affect them so severely, they're less likely to, always be thinking about it all the time.
Yes, to have that health
Mm,
anxiety. Yeah, that's a really
yeah.
good point. So we've
Mm,
talked about the challenges and vulnerabilities at school and
mm,
the condition itself and symptoms and side effects.
mm,
Um, as we get to the end of our conversation, uh,
mm,
what do you think is happening now to address these challenges and vulnerabilities that asthma presents in school?
mm.
And is it enough, or what would you like to see if there was an ideal situation?
Yeah, look, I mean, there are organizations like the National Asthma Council of Australia who, provide great resources, including like school kits and training and so on. But, I guess, uptake can be a little bit patchy. And, as I mentioned, sometimes enforcement of certain policies, like asthma policies at school, is not always consistent across the
Mhm.
board. Like I do have, like I said, those parents coming in and getting their asthma action plan updated, but it's not always going to be 100% across the board. So I think having just that really consistent guidance, because the reality is that life gets busy, right? And I totally understand that. As a parent myself, I work, and there's lots of things to do, and sometimes just if your child is well, bringing them to see the doctor to get their asthma action plan updated is kind of like really on the back burner, and I get it. But it is important, especially when we are human and we're prone to forget that there are all these other things in place, and so that's why I see the school is just another way of saying, hey, your child's got asthma. We just realized, we noticed this. Could you get an updated asthma action plan? And it's just another point where, it just raises the parent, oh, yes, we haven't reviewed,
Mm,
my son or my daughter's asthma for a whole year now. Like maybe it's time to go see the doctor. And it just initiates that conversation as
yeah.
well. So I think this is where, obviously, if you can, have the space and time to be more proactive, that would be great. But we realize that life can get busy. And so that's why I think, yeah, getting the schools on board is really helpful. Mm.
Yeah, indeed. And given everything else that you've said, this is a part of good management,
Mm,
particularly in
that's
an
right.
environment where there can be more triggers.
Yeah.
And
Yes.
having that sitting in a health plan in the school, but also
Mm,
an individual learning plan if needed,
mm,
especially if there is recurring absences across the whole school life, which can add
yeah.
up to a lot of missed time.
Mm, mm,
And the research says that there's no safe threshold for absence. Anything more than
mm,
10%, which is
mm,
I think 20 days a year,
yeah. Mm,
is going to put children in a
mm,
challenging place
mm,
academically and then emotionally
yeah.
as well.
Mm,
So I think, when we add all of these things together,
mm,
what Joel's saying is so important. There's that
mm,
consistency to have that plan in place in the school as well.
mm, mm,
And that will then give the signals also around the disability standards for education, which as a national regulation that covers all schools,
mm,
means that the right supports can be put in place if
mm,
additional um, teaching and learning support is needed due to absences or even just experience in the school or adjustments that might make it
mm,
better. For example, with sport,
mm,
if a student couldn't participate in a sporting event, well, we
mm,
don't want them just sitting there left out. We want some other
mm, mm,
ways to be inclusive, and
Absolutely.
that's what this having the up-to-date plan and the
Mm,
disability standards can enable and signal to a
mm,
school to do. And of course, that is all, funding from government that goes down to support those
mm.
adjustments through the disability standards. So,
Yeah.
as we close out, is there anything else that you would like to say about quality of school life for asthma?
Hmm. Yeah, look, just I guess rounding up, I just really hope that, all those who are listening, especially the parents, that the key message for me is that really want you to be empowered, to, make those decisions, on behalf of your child, because, they may not necessarily know what's going on. And if you even suspect, if there are questions in your mind, could my child has asthma, go and see your doctor, raise that question to them, so that that they can think about it as well. Because sometimes, GPs can have a lot of things that we're thinking of. We're seeing all these things. Oh, maybe your child is not up to date with their vaccinations, and we're also thinking about lots of other things too, about the health of your child. But if you have that question, just ask, do you think that this cough is asthma? And just put
Mm.
it to the GP. And I just really want to, empower all the parents out there. If you're thinking about it, talk to your GP and just ask the question. And then that
Mm.
way you can kickstart that process to diagnosing it, and if it is indeed asthma, then treating it and managing it properly.
Yeah, thank you.
Mm.
Our call to action as we end is usually to ask, what's your call to action for asthma in 7 words or less? And I think you
I hear
might
that.
have just said it then, is if you're thinking about it,
Yes.
ask the question.
Yeah.
Um, yeah. If you'd like to give a call to action with a different set of 7 words or less,
7 words.
go for it.
Okay. Yeah, yeah. I guess my hope, I guess in 7 words or less, is that to empower every family to manage asthma confidently.
Oh, that's beautiful. That's such a
Mm.
perfect ending. It's been so wonderful to talk to you today.
Mm.
A big shout out to National Asthma Council Australia. You can find them at nationalasthma.org.au. Is that correct, Joel?
Yep.
Nationalasthma.org.au. And from us to you, thank you for joining us today, Dr. Joel
Mm.
Tan. It's been amazing to have your insights and your medical experience and knowledge brought to bear here, and your lived experience as well.
Thank you.
Thanks everyone for tuning in. Help us turn up the volume so all kids are seen and heard. Follow along, like, share, comment, or leave us a review, because we love hearing from you. And if you want to donate, head to MissingSchool.org.au, because every dollar makes a difference.